My name is Bruno Conte. I'm the CEO and the president of Connected Health Now, which is an international community leveraging digital transformation of health. So basically, my history was based on 40 years ago when I started to become a digital entrepreneur. And since then, I was putting digital tools at the service of the world. And my mission today is basically to be a social entrepreneur fighting any social issue using digital tools. That's my history. In order to have one single point of touch about everything that happens toward you, means that basically we are putting in practice one new wave of the digital medicine. The patient is the person which is battling the cancer. All the rest, caregiver, professional caregiver, what's behind you, the medical doctors are helping you to fight the cancer, not being the ones at the center of the action, but you are at the center of the action. So in that case, basically, the patient should help themselves with all the others. Researchers, medical doctors, pharmaceutical companies can just learn about the big data, the behavioral data around the patient in order to, let's say, mix those big data, because we are right now using artificial intelligence, we are using big data, IoT, wearable devices, everything around you, collecting those information and try to fight cancer for the next level. So basically almost automatically. And in that case, obviously the community worldwide, if you are having not just 10,000 people in a sort of research environment, but 10 million, makes a lot of difference. And every one of us is generating so much information, sometimes not clinical, but just behavioral. And this is so important for the research. The fact is that at the preliminary 5-10 years, for example, the Alzheimer patient is going to a specific hospital and goes to the hospital for, let's say, 15 days, 1 month every year. The clinical doctor is seeing the patient just for 1/20th of his life. All the rest is with your husband or wife at home, and those behavioral data are so much more important than just the clinical data, that those data the clinical doctor is missing. In that case, helping with the IoT, with cameras, with the caregiver bringing a smartphone, for example, and putting, okay, today is going well, or today he was trying, let's say, to remind, let's say, the nephew or something else. It's important in order to see the progress of the Alzheimer, and doing so, basically, it is helping a lot today with Alzheimer, and we can just collate exactly the same methodology to the cancer. Unfortunately, doctors sometimes are disconnected. That's why we would like to connect them to the patient, because the patient is the center of the action. Doing so, basically, with Fight Cancer Global and mixing together our actions is, I think, our potential partnership.